The nose is an extraordinary organ that plays a crucial role in our daily lives. It is not only responsible for our sense of smell, but it also serves as a primary organ for breathing. In this video, we will explore the various aspects of the nose, including its anatomy, functions, and common disorders. So let's dive in and learn more about this remarkable part of the human body. The nose is a vital part of the respiratory system. It is located in the center of the face between the eyes and above the mouth. The nose consists of two nostrils, which are the openings through which air enters the nasal cavity. The external part of the nose is made up of cartilage and bone. It has a unique shape and size in each individual, contributing to our facial features and identity. The bridge of the nose connects the upper part of the nose to the forehead. The inside of the nose is lined with a specialized membrane called the nasal mucosa. This mucosa is responsible for producing mucus, which helps to moisten and warm the air we breathe. One of the primary functions of the nose is to filter the air we inhale. The fine hairs present inside the nasal cavity, called cilia, trap large particles and prevent them from entering the lungs. Another important function of the nose is to humidify the air we breathe. As the air passes through the nasal cavity, it gets moistened by the mucus secreted by the nasal mucosa. This helps to prevent dryness and irritation in the respiratory system. The nose is also responsible for our sense of smell. The olfactory nerves located in the nasal cavity detect and transmit signals to the brain, allowing us to perceive different scents and odors. The sense of smell is closely linked to our sense of taste. Without the ability to smell, our perception of flavors would be significantly diminished. The shape and size of the nose can vary greatly among different individuals and ethnicities. Some people have a prominent nose while others have a more subtle or flat nose shape. Apart from its functional roles, the nose also plays a significant role in our facial aesthetics. Many people seek cosmetic procedures such as rhinoplasty to alter the shape or size of their nose for aesthetic reasons. The nose is also an essential organ for speech production. It plays a crucial role in controlling the airflow during speech, influencing the production of different sounds and phonetics. The nasal cavity is divided into two halves by a thin wall of cartilage called the nasal septum. In some individuals, the nasal septum may be deviated, leading to breathing difficulties and a condition known as deviated septum. Sinuses are air-filled cavities located within the bones of the face and skull. The sinuses are connected to the nasal cavity and help to lighten the weight of the skull and produce mucus. There are four pairs of sinuses: the frontal sinuses, ethmoid sinuses, phrenoid sinuses, and maxillary sinuses. These sinuses can sometimes become infected, leading to a condition called sinusitis. Sinusitis is characterized by inflammation of the sinuses, causing symptoms such as facial pain, nasal congestion, headache, and postnasal drip. It can be acute or chronic, requiring medical treatment in severe cases. The nose is susceptible to various disorders and conditions. Some common nasal disorders include allergies, nasal polyps, nasal fractures, and nasal tumors. Allergies such as hay fever can cause nasal congestion, sneezing, itching, and a runny nose. These symptoms occur when the immune system overreacts to allergens in the air, such as pollen or dust mites. Nasal polyps are non cancerous growths that develop in the lining of the nasal cavity or sinuses. They can cause nasal congestion, decreased sense of smell, facial pain, and snoring. Nasal fractures, also known as a broken nose, occur when the bones in the nose are damaged or broken due to trauma or injury. Symptoms include pain, swelling, bruising, and difficulty breathing through the nose. Nasal tumors can be benign or malignant growths that develop in the nasal cavity or sinuses. They can cause symptoms such as nasal congestion, facial pain, nosebleeds, and a decreased sense of smell. The nose is prone to nosebleeds, also known as epistaxis. Nosebleeds can occur due to dry air, trauma, high blood pressure, or certain medical conditions. Most nosebleeds are not serious and can be treated at home. Rhinitis is the inflammation of the nasal lining, which can be caused by several factors such as allergies, infections, or irritants. It leads to symptoms such as nasal congestion, sneezing, itching, and a runny nose. Rhinitis can be classified as allergic or non allergic. Allergic rhinitis is caused by an immune response to allergens, while non allergic rhinitis is triggered by irritants, change in weather, or hormonal imbalances. Nasal irrigation, also known as nasal rinsing or nasal lavage, is a technique used to clean the nasal passages. It involves flushing the nasal cavity with a saline solution to remove mucus, allergens, and debris. Nasal breathing is considered more efficient and beneficial than mouth breathing. Nasal breathing helps to filter, warm, and humidify the air, preventing dryness and irritation in the respiratory system. Nasal decongestants, such as nasal sprays or oral medications, can provide temporary relief from nasal congestion. However, long term use of these medications can lead to a condition known as rhinitis medicamentosa, where the nasal congestion worsens due to rebound effects. The human nose is capable of detecting a vast range of smells, ranging from pleasant fragrances to unpleasant odors. Different scents can evoke various emotional and physiological responses in individuals. Anosmia is the loss of the sense of smell. It can be temporary or permanent and can result from various causes such as nasal congestion, head trauma, viral infections, or certain medical conditions. Hyposmia refers to a reduced sense of smell. It can occur as a result of aging, nasal congestion, upper respiratory infections, or certain medications. Hyperosmia is a heightened sense of smell where individuals are more sensitive to odors and smells. It can be present in certain medical conditions such as migraines or neurological disorders. The sense of smell plays a significant role in our daily lives. It helps us to discern the quality of food, detect potential dangers, and enjoy the pleasure of pleasant scents. In conclusion, the nose is impressive and multifaceted organ that plays a vital role in our overall well-being. From its complex structure to its crucial functions in breathing, smelling, and even adding character to our appearance, the nose is truly remarkable. As we wrap up, I encourage you all to take a moment to appreciate the incredible capabilities of this often underestimated body part. Whether it's taking a deep breath of fresh air or savoring the aroma of your favorite fragrance, let's celebrate the incredible feat of nature that is the human nose. Thank you for joining me on this exploration, and I hope this video has deepened your understanding and appreciation of this remarkable feature. Stay curious, and I look forward to share more fascinating discoveries with you in the future.